Hello and namaskar, Sat Shri Akal, Salam Alaikum, my friends. Once again, your personal physician, doctor is with you, Dr. Kapoor, once again with a new something I always come up with related to the heart, to the medical conditions. तो आज एक जो चीज़ मैं ਤੁਹਾਡੇ ਸਾਹਮਣੇ ਦੱਸਣ ਜਾ ਰਿਹਾ ਹਾਂ ਬਹੁਤ ਪੁਰਾਣੀ ਨਹੀਂ ਕੱਲ ਦਾ ਇੱਕ ਕਿੱਸਾ ਹੈ ਉਹਨੂੰ ਐਲੋਬਰੇਟ ਕਰਕੇ I will come to the point ਕਿ ਮੈਂ ਇਸ ਟੌਪਿਕ ਦਾ ਨਾਮ ਰੱਖਿਆ ਹੈ ਹਾਰਟ Be truthful to your doctor. दुनिया ट्रस्ट से काम करती है. You should have trust on yourself. You should have trust with the friend you make, and you should have a trust on the doctor whom you visit. So be truthful to him. He'll maintain all his privacy, your privacy, and keep the facts to himself. कल द केस है एक अंग्रेज मेरे को लाया. I'm middle aged, 50s which होएगा, and he had shifted to our city 3-4 months ago only. He was, I think, in some far east country, I think Indonesia, Malaysia. He told me the first encounter with him. So we started very nicely. My nurse took all the history details, came up with the vitals, everything very fit, normal, very good. So I said, why you want to do this? He wanted to do the ECG and stress test. He said, it's just for my own sake and this and that. I said, you have come all the way, hearing my name, so let me know what your symptoms are. तो कहा कुछ नहीं ऐसी कोई चीज़ नहीं है एक्चुअली प्री एम्प्लॉयमेंट इंश्योरेंस होती सारी लाइफ इंश्योरेंस कुछ आई थिंक सम यूरोपियन इंश्योरेंस ही गेव मी द नेम कि उन्होंने चाहिए है मैं कि ठीक है वी डू फॉर लॉट ऑफ प्री इंश्योरेंस पीपल एज ए प्री insurance life medicals are being done and stress test and ECG is there. But still I asked him, since you have come to me, I have to do a small historical elaboration from you. कि elaborate का कोई history symptom ने तो अनु कहना नहीं कुछ नहीं मैं कोई तकलीफ होती है साफ फूलता है palpitation कुछ होता है chest pain. This is important once a person comes to a cardiologist from this point of view is very important. We ask all the symptoms, any family history, any surgical history, so any past medical history, then including social history like smoking or drinks. And so we do a risk stratification, starting from the age, the race he's coming, the symptom he has, the family history he has, what medication he's taking. ਉਹਦੇ ਨਾਲ ਇੱਕ ਅਸੀਂ ਅੰਦਾਜ਼ਾ ਲਗਾ ਲੈਂਦੇ ਕਿ ਇਸ ਕਿਸ ਡਾਇਰੈਕਸ਼ਨ ਵਿੱਚ ਜਾ ਰਿਹਾ ਪਰ ਯੰਗ ਬੰਦਾ ਆਉਂਦਾ 25 ਸਾਲ ਦਾ ਉਹਨੂੰ ਕੋਈ ਤਕਲੀਫ ਨਹੀਂ ਉਹ ਐਥਲੀਟ ਬਣਨਾ ਚਾਹੁੰਦਾ ਹੈ ਫੁੱਟਬਾਲ ਟੀਮ ਵਿੱਚ ਪਾਰਟ ਲੈਣਾ ਉਹਨੇ and he wants to become we do stress tests on FIFA standards and give them the fitness and we need not ask them much details except a few things and we make from the very beginning we make an idea that he doesn't have any significant issue but once in a while there also we can get so we examine them तो किस्सा मैं ज़्यादा not to prolong it I trusted him and took him for the ECG. ECG was normal, blood pressure was normal, vitals were normal. Sister's history, nothing was significant. My historical statement he gave to me, everything normal. मैं stress test शुरू किया. Stress test machine होती है ना treadmill से चलाते हैं उधर connected होता है heart and everything. So that we monitor them, blood pressure, pulse, rhythm and all. But the first class, the first stage निकाल गया, second stage निकाल गया. Usually insurance which ऐसी कोशिश करते हैं the best stress test हो जाए तो they are not rated for that and lot of factors are there if they could do a good effort tolerant. तो third stage मैं अंदर अपने दूसरे कमरे में आया but in between there is a window I keep on watching. तो मैं देखे यार उन्हें मैं what happened suddenly कि I had left him at the rate of 92 in the third stage and 7:54 his rate is 214. मैं क्या हो सकता है कुछ नॉइज फैक्टर आया कुछ मैं दौड़ के गया तो देखा वाकई 214 एंड ही वाज रनिंग ए पैरोक्सिज्म ऑफ अ वेरी डेडली सिचुएशन नोन एज एट्रियल फिब्रिलेशन मैं भी हैरान यार मैं इमीडिएटली रोका एंड यू नो resuscitation red alert everything patient didn't had much symptom but he had palpitation and breathlessness which he was not telling me even you know this is what I want to emphasize in this presentation of mine कि he did not declare in while doing the test also he's not telling me I'll come in retrospect how these things came up then तो मैं फौरन रोकिया उधर रेट काटना है some measures सब you know crash trolley everything was ready all my nurses you know the technical staff the ambulance was ready and all किसी तरह वो फिर धीरे धीरे सेटल हुआ, but still the heart rate at resting, which was starting 60, it remained at 110, 114 irregularly. Pulse, blood pressure was a little on the lower side. Immediately we transferred him to the hospital, in hospital care, in ICU, intensive cardiac care unit, and where of course he was by that time stable. We gave him injection for thinning the blood and all, so that the clot doesn't form and doesn't affect his heart. But we wanted to know the reason. We did an angiogram, and ultimately we found that his heart enzyme went up. He developed a small heart attack, and we had to do his angioplasty. We had to open up that. He had blocks. Now in retrospect, he gave all these small symptoms. I used to have chest pain and something. I didn't give importance to that, and it was a pre-life insurance. You know, उत्थे बहुत झूठ बोलते ने लोग जाके इंश्योरेंस दे एजेंट नाल जाके बहुत झूठ बोलते ने कि सानू कोई तकलीफ नहीं है, बिल्कुल फर्स्ट क्लास है। इंश्योरेंस वाले भी बिजनेस विच ने दे सेंड देम टू अस, बट when he came to us, he should have come as a patient and he should have trusted himself and myself. Otherwise, he was endangering his life. Actually, he was nearly, you know, on the deathbed with that heart rate and his pressure going sinking and all. And thankfully, we could manage him. But this is an important take-home lesson I want to bring my friend. मैं ਤੁਹਾਨੂੰ ਦੱਸਣਾ ਚਾਹੁੰਦਾ ਕਿ ਜਦ ਵੀ ਤੁਸੀਂ ਡਾਕਟਰ ਕੋਲ ਜਾਓ ਆਪਣੇ ਪੇਸ਼ੈਂਟ ਐਜ਼ ਅ ਪੇਸ਼ੈਂਟ, ਤਾਂ ਉਹਨੂੰ ਇੱਕ ਚੀਜ਼ ਸੱਚਾਈ ਨਾਲ ਦੱਸੋ, ਕੋਈ ਝੂਠ ਨਾਲ ਫਾਇਦਾ ਨਹੀਂ ਹੈ। You can be on the deathbed. This is what happens. You hear a lot of people doing stress tests at home, not going to the doctor and ignoring it. This is equivalent to, you know, same thing, and then they drop down, and even you must have heard a lot of them don't survive even because of the cardiac arrest. ਅਸੀਂ ਬੈਠੇ ਹਾਂ ਇਸ ਵਾਸਤੇ, ਤੁਹਾਨੂੰ ਦੱਸਣ ਵਾਸਤੇ ਬੈਠੇ ਕਿ ਕੋਈ ਐਸੀ ਚੀਜ਼ ਐਕਸਰਸਾਈਜ਼ ਨਾਲ ਹੋ ਸਕਦੀ ਹੈ ਕਿ ਨਹੀਂ ਹੋ ਸਕਦੀ, ਕੋਈ एहतियात बरतनी है कि नहीं, कितनी एक्सरसाइज करनी है, कद करनी है, क्यों करनी है, सब ਤੁਹਾਨੂੰ ਐਕਸਪਲੇਨੇਸ਼ਨ ਤੁਹਾਡਾ ਹਾਰਟ ਸਪੈਸ਼ਲਿਸਟ ਦੇਗਾ। ਬਟ ਉਹਨੂੰ ਸਿੰਪਟਮਸ ਵੀ ਦੱਸੋ, ਆਪਣੇ ਉਹਨੂੰ ਪ੍ਰੋਬਲਮ ਦੱਸੋ। ਨਹੀਂ ਤਾਂ ਆਈ ਵੁੱਡ ਹੈਵ ਟੇਕਨ ਅਨਦਰ ਰੂਟ ਇਫ ਵੁੱਡ ਹੈਵ ਟੋਲਡ ਮੀ। ਆਈ ਵੁੱਡ ਹੈਵ ਡਨ ਹਾਲਟਰ, ECG, cardiac enzyme. So this is a lesson, of course, I learned, but you know, when the person is not telling me how, I will not use a stick to my patient। ਦੱਸ ਤੈਨੂੰ ਕਿ ਨਹੀਂ ਤਾਂ ਮੈਂ ਡੰਡਾ ਤਿਆਰ ਹੈ ਤੇਰੇ ਵਾਸਤੇ, ਐਥੇ ਨਹੀਂ ਕਹਾਂਗੇ ਨਾ। ਅਸੀਂ ਪਿਆਰ ਨਾਲ ਹੀ 2 ਵਾਰ ਪੁੱਛਾਂਗੇ, ਤੇ ਮੇਰੀ ਨਰਸ ਪਹਿਲੇ ਪੁੱਛ ਚੁੱਕੀ ਹੈ। ਈਵਨ ਸਾਡੀ ਅਪਾਇੰਟਮੈਂਟ ਜਾਂਦੀ ਹੈ ਤੇ ਪਹਿਲੇ ਪੁੱਛਦੇ ਹਾਂ ਕੋਈ ਸਿੰਪਟਮ ਨੇ ਕਿ ਐਮਰਜੈਂਸੀ ਤੇ ਨਹੀਂ ਹੈ, ਨਹੀਂ ਦੱਸਿਆ ਉਹਨੇ। ਤੇ ਇਹ ਹਾਰਟ ਰੇਟ ਦੀ ਉਹਦੀ ਮੈਂ ਛੋਟੀ ਜਿਹੀ ਦੱਸ ਸਕਦਾ ਕਿ ਉਹ ਪ੍ਰੋਬਲਮ ਹੋਈ ਸੀ ਕਿ ਉਹਦਾ ਹਾਰਟ ਰੇਟ ਨੋਰਮਲ ਤੋਂ ਇੱਕਦਮ ਜੰਪ ਕਰਕੇ ਇਰੈਗੂਲਰ ਹੋ ਗਿਆ। ਉਹ ਐਰਿਥਮੀਆ ਜਿਹਨੂੰ ਕਹਿੰਦੇ ਨੇ, ਉਹ ਹੋ ਗਿਆ। ਤੇ ਅੱਜ ਤੋਂ ਬਾਅਦ ਮੈਂ ਆਪਣੇ ਦੋਸਤਾਂ ਨੂੰ, ਭਰਾਵਾਂ ਨੂੰ, ਭੈਣਾਂ ਨੂੰ, ਸਭ ਨੂੰ ਕਹਾਂਗਾ ਕਿ ਕੋਈ ਵੀ ਛੋਟੀ ਜਿਹੀ ਤਕਲੀਫ ਹੋਏ, छोटी जी भी तकलीफ है। Recently one of my friends wife passed away, unfortunately, in my city Kanpur, from where I come. She was having small mild symptom. Every day that your friend used to call me, almost every other day or third day, and he was never informed by his wife, or even if she just say, oh, gas hai, she was not investigated. One fine morning she went into cold weather, developed sudden breathlessness, came home, she was in pulmonary edema, एकदम heart fail हो गया। तो ਇਹ किस्से सानू बहुत सुनाई देंदे ने, because we are into that field, but we do want to divulge this to all our community. This is what the community outreach it works. So once you come to realize that how important is to share your symptoms with your doctor, it can be life-saving. So my brothers and sisters, this is my request to all of you, to be good with yourself, and to be good with yourself, trust your doctor, divulge him each and every fact, even if it's not important from your side. Maybe it's important for a doctor to know some of the things, and then only you can expect the best health outcome, advice from your doctor. In any case, these things do happen 1 in 1,000, but it's my duty to share with all of my friends, brothers and sisters, because you are with me on my YouTube channel for such a long time. If you're not with me, please do subscribe to my channel. And if you like my programs, do share with all of your friends in whatever media you can, especially Facebook, Instagram and all. And I'm always there at your support for your any health advice. We will take care of you. Thank you so much. May God bless you and namaskar.